Everyone, myself Deep Ranay. I am here to present on the topic Insights from the Indian Tuberculosis and Data Analytics Exploration under the guidance of Ms. S. Mridula ma'am with my fellow batchmates Pavani, Nagahashita and Pranit Verma. To the wealth of data provided by the Ministry of Health and Family Welfare, our project is dedicated to unraveling the intricate challenges posed by India's tuberculosis epidemic. Given the vast population and diverse demographics, the nation encounters formidable obstacles in controlling TB transmission and prevalence. TB remains a significant public health concern in India, with millions of cases reported each year. The disease affects marginalized communities, urban slums, and rural areas. Existing socioeconomic disparities, factors such as poverty, malnutrition, overcrowding, and limited access to healthcare services contribute to the persistence of TB transmission across the country. In the context, our initiative leverages the capability of Python data analytics to meticulously explore this extensive dataset. The primary goal is to discern significant trends, model incidence rates, and formulate evidence based strategies for effective TB control. By harnessing advanced analytic techniques, we seek to uncover patterns in TB prevalence, identify high burden regions, and pinpoint demographic groups most at risk. Through a thorough examination of the multifaceted dynamics inherent in TB, we aim to provide stakeholders with actionable insights. These insights will empower them to craft targeted interventions and policies that specially addresses the unique needs of India's diverse population. From implementing community-based screening programs to enhancing healthcare infrastructure and access, our analysis aims to inform comprehensive approach to TB prevention, diagnosis, and treatment. By adopting a rigorous analytic approach and promoting informed decision making, our endeavor seeks to make a meaningful contribution to the broader effort of combating TB and preserving public health in India. Through collaboration with policymakers, healthcare professionals, and community leaders, we strive to catalyze positive change and reduce the burden of TB on individuals, families, and communities across the nation.
Hello everyone, myself Pranit. I'm going to explain about dataset used. We have taken this dataset from Kaggle website. The Indian Tuberculosis Dataset 2023 provides a comprehensive overview of the tuberculosis epidemic in India and efforts to be end TB across the country, published by the Ministry of Health and Family Welfare and also the Department of Health and Family Welfare. Key statistics are broken down to state and age groups and other demographics to identify high-risk populations by evaluating India's TB burden and response at nations and state level annually. This report enables us targeting interventions and policies to successful combat tuberculosis in alignment with WHO and TB targets. The dataset allows researchers, policymakers, and health professionals to understand TB trends and graphs in order to strengthen India's response to the major public health threat.
Myself, Pavani. Now I'm going to continue objectives. First one, analyzes individual trends. Infectious disease primarily affecting the lungs caused by the bacterium, microbacterium, tuberculosis. Global efforts have been made to control TB, but challenges such as drug resistance and other factors relations among those factors. There are strong correlation factors between TB and diabetes and also TB and tobacco or alcohol use. Individuals with diabetes, smokers, and heavy drinkers are at high risk of developing TB and experiencing poor treatment outcomes. Identify high risk groups. High risk, high risk heavy drinkers, individuals with alcohol use disorders. And meaning high risk groups includes heavy drinkers, individuals with alcohol use disorders, and marginalized population with limited access to healthcare. Interventions involves alcohol screening and brief interventions, counseling, and access to rehabilitation services. Access treatment effectiveness. Develop targeted interventions for reducing TB transmission and mortality considering all factors. targeted interventions, implement integrated screening programs for TB and diabetes, especially in high risk population, enhance tobacco and alcohol essential programs addressing the needs of individuals with TB and diabetes, strengthen healthcare system to improve access of TB diagnosis and treatment, as well as diabetes management, smoking, reduce alcohol intake, and regular exercise to reduce the burden of TB and diabetes. Shita will continue implementation.
I'm Harshita, and now I'm going to tell about the implementation of our project. Our project leverages the robust capabilities of Python libraries such as Pandas, NumPy, and Matplotlib for data analysis and visualization. With these powerful tools, we can clean and process the data tuberculosis dataset 2023, ensuring data accuracy and consistency for reliable analysis. Through advanced data mining techniques, we meticulously identify trends, patterns, correlations within the dataset. By exploring various attributes and variables, we uncover insights into TB prevalence, treatment adherence, and associated risk factors. Furthermore, we employ machine learning algorithms to develop predictive models for TB incidence rates. By training these models on historical data and relevant features, we can forecast future trends and identify potential hotspots for targeted interventions. The insights generated from our analysis serves as a foundation for evidence-based strategies aimed at TB control in India. By understanding the drivers of TB transmission and mortality, we can design targeted interventions that address specific community needs and challenges. Through iterative refinement and validation, our predictive models and analytical frameworks contribute to a deeper understanding of TB dynamics and facilitate informed decision making by policymakers, healthcare professionals, and other stakeholders. Ultimately, our utilization of Python libraries, coupled with regional data analysis and modeling techniques, empowers us to make meaningful strides in the fight against TB, yielding the development and implementation of effective interventions to improve public health outcomes in India. Now, my friend Pranay is going to conclude our project.
I want to conclude that our project harnesses the power of Python data analytics to navigate the complexities of TB dynamics, pinpointing areas for urgent interventions. Through evidence-based strategies, we address diverse community needs and collaborate with stakeholders for collective action. By forcing partnership with researchers and community leaders, we tailor interventions to specific populations, ensuring a comprehensive response to TB. Our commitment to safeguarding India's populace drives us to continually enhance treatment outcomes and mitigate social and economic factors contributing to TB spread. With unwavering dedication, we strive to contribute significantly to reducing TB incidents and improving the overall well-being of our communities. Together, we stand as a beacon of hope in the relentless battle against this formation public health threat. Stands as a hope in the fight against tuberculosis within India. Through meticulous data analysis and informed decision making, we glean vital insights from the Indian tuberculosis dataset 2023, unraveling the intricate web of TB prevalence, treatment adherence, and high risk populations. Armed with this insight, we force ahead in formulating targeted interventions and policies meticulously aligned with WHO and TB targets. In doing so, we bolster India's response to the formidable public health threat, embodying a commitment to safeguarding the well being of its populace. Thank you.